have Ben Reid with me, who's the Executive Director of the AI Forum of New Zealand. So thanks for coming. So tell me a little bit about what you presented on today.
Recently, the AI Forum, we released our report, Artificial Intelligence Shaping a Future New Zealand. And this is the result of about 9 months of research, really looking across the landscape across New Zealand, looking internationally and seeing what we're doing in AI, where we need to invest more and how we really stack up against what's happening internationally.
And health is obviously features in there. I think it uses the expression there's immense potential. Can you just expand on that a little bit in terms of AI and the...
Yeah, so AI is a name for a sort of collection of technologies, all of which are very sort of horizontally applicable. And so, you know, in many ways, almost any problem that you can think of to solve AI could be applied to help you in a solution to that problem. And so, you know, some of the main challenges that are affecting health at the moment are productivity and efficiency, managing large amounts of data, and also the clinical use cases as well. So artificial intelligence really has the potential to be applied in all of those spaces to deliver, you know, really a step change in our productivity and a step change in the sort of clinical outcomes that are being achieved.
Are there any particular challenges around the application in health, considering health data is probably the most personal, confidential data we
Absolutely.
hold?
So you've hit the nail on the head. So, you know, artificial intelligence and machine learning are, you know, they're fueled by data, and so the ready availability of data, well structured, well pre-processed, to enable machines to find patterns in that data and then use that to make better predictions about the future, and to also enable better decision making. So yeah, absolutely. The way that data is, first of all, is spread across numerous data silos is a challenge, and it's a challenge not just for artificial intelligence, but for managing health data across the whole system. And also the privacy concerns that and the actual concept of data ownership and the ability for patients to actually manage their own data. We're just starting to have those conversations, and the impacts on how we can use that data to basically aggregate it to gain anonymized data sets from which we can then make decisions about better health outcomes. We're at very early days of trying to achieve that.
And so, having done the research, looked at this, where we're at, where we're heading, how do you feel about where New Zealand's placed to take advantage of this sort of revolution?
So New Zealand places well, and we've got part of the research. We went out and looked around the ecosystem here. Came up about 140 organisations, and there's plenty more come in since. That are working with AI, thinking about AI, investing in AI right now. Across the health sector, we've identified organisations like Precision Driven Health, who are really pushing the boundaries of modern research in using AI and big data techniques. So New Zealand has challenges with scale. So we looked around the world at some of the other countries, our peer countries, and also much larger countries than ours. So China, for example, is investing billions of dollars right now in a national coordinated AI strategy, which involves right from developing talent at school age, so teaching machine learning techniques in school, right through to investing in fundamental AI research, and then commercializing that research. So the Chinese aim to create an AI industry of about $150 billion a year by 2030, and New Zealand really is not going to be able to compete at that scale. So we really need to find the niche applications where New Zealand can excel, and those will exist in health, and then we need to invest now.
Great. Well, thank you very much for your time.